Welcome back to Real Talk with Myron, where we have real stories with real people. And I have my guest today, Dr. Michael Badger. And I'm going to let him tell you a little bit about himself.
Good afternoon, good evening. I'm not sure what time this thing is.
It's okay.
My name is Mike Badger. I'm a native of Jacksonville, Florida. Practicing dentist in Orlando, Florida. I've been in Orlando probably 27 years. I practice all aspects of dentistry. I love what I do. I love to come home, and I love to be able to share a little bit about that experience and how my walk with dentistry has evolved over the past 35 years of what I've been doing.
Yeah, they said you've been doing it for 35 years.
35 years.
Wow, that's a long time to be doing dentistry.
Yeah.
What is that like? Has it changed? Has it evolved any?
Yeah. Dentistry changes every 4 to 6 months as far as technology. And now we live in a digital age. Everything we're doing in this room is just digital setup. It used to be analog. So dentistry has kind of adapted those same things as far as making it much easier to do what we do. The things that make folks fearful of going to the dentist are not really as prevalent in dentistry as it used to be. So you have a lot more things which are much more predictable, predictable outcomes, less downtime or practically no downtime as far as discomfort. And also it helps control costs. But I've watched it evolve from when I started. And the procedures I used to do, I don't do those anymore.
Right.
It's become less invasive. We have technologies now where I can actually bring patients in and utilizing AI platforms, and I can actually see tooth decay right on the X-rays, and it can see things that I may miss, or it can see things in its earliest stages. And the best dentistry any dentist can do for you is the least amount of dentistry. But to get the least amount of dentistry, that means you got to go in to see them on a regular basis to catch it when it's at its earliest stage.
Right.
Regular physicians, if you're an oncologist, you want to catch cancer early on. Right. We want to catch tooth decay and other dental diseases early on because that actually makes it less invasive and a much more comfortable experience. Right. And if I create that experience for anyone, they're more likely to keep coming in to make sure we maintain it. So maintenance is everything. Right. But again, back to AI, I can put something up on the screen and I can actually show it to the patient in real time. This is what's going on in your mouth right now. And I have the ability to treat those conditions. No shots, no drills. I treat the tooth. It takes 3 seconds to do it. And I can guarantee you 98% of the time that tooth will regenerate and grow enamel back where there's tooth decay.
With the new AI, everything going, that's incredible.
Yeah. Yeah.
That's incredible. That's incredible.
And patients say, you know what, wait a minute, you can fix that and I don't have to get a shot. I don't have to get a drill. And it's going to cost me, less than $100. And yeah, that's where we are in dentistry now.
Right. It's a lot of trauma going on. Well, a lot of trauma for people thinking about dentistry, because when you think about dentists, you think about uncomfortable feeling, you think about pain, you think about you have to go to the dentist for some type of pain that you're in, or you think about maybe you're going to dentistry because you just want to get your teeth clean, but even that hurts used to.
We have a major information block as far as what can be done and when it should be done. Folks say, I'm going to the dentist when I get some insurance. That's a mistake.
Okay.
Right? Your insurance policy will never cover your losses of what you need as far as dentistry if you stay away 3, 4, 5 years. So for every year you stay away, just say, okay, it's going to cost me about $3,000 for every year. And the typical insurance policy, if you're waiting on that, it'll probably cover anywhere from $1,500 to $3,000, and it won't cover your needs. So we have that, that we have to raise our dental IQ in our communities to say, you know what, the best way to stay out of a dentist chair
is to stay in one.
Stay in one. Go often. And that way your expenses are so minimal because you're paying for maintenance and you're paying for those checkups. But if you sit there and let it brew, it's like, if you have a leak in your roof,
right,
you're going to get the roof fixed right away.
Right.
Dentistry doesn't give you any symptoms until it's too far gone. Yeah, we know this because you and I have, like, man, this thing's killing me in the middle of the night.
Right.
But typically that's what we do. I ain't going up in there until it hurts. When it hurts, when you wait until it hurts, it's going to hurt not only in the mouth, but it hurts in your wallet.
Right.
So it's better to go regularly.
What is a good time to go? Like how many times a year? Should it be every 6 months, every 3 months, or does it differ per patient?
It's per patient. I mean, a typical healthy patient who has no evidence of any disease or anything like that, like twice a year. Twice a year. If you do have some underlying disease and you have what's called periodontal disease. Periodontal disease is a condition that 70% of the general population has, but it presents no symptoms. If you have bleeding gums, if you have loose teeth, you have bad breath, and those are just some of the symptoms of periodontal disease. And it afflicts the African-American community more so than it does any others.
And why is that?
Lack of knowledge about the condition, miseducation, misinformation. If you haven't been a dentist in 10, 15 years, even though you're brushing like crazy, you still probably have some underlying disease. And that disease can be very severe, or it can be very moderate, or it can be very minimal. We want to catch you when it's minimal and have that condition treated. So that way, again, your visits are pleasant.
Right. Do you recommend any type style of toothbrush or any type cleaning, any type floss? I mean, I know you can't advertise nothing, but do you?
Flossing is floss.
Yeah.
Brushing.
How about
I don't recommend a certain brand. I just say if you're using it, that's what's most important.
The electric toothbrush.
Electric toothbrushes are going to clean 40 to 50%, proven to clean 40 to 50% better than a manual brush.
Okay.
But you just want to have soft bristles no matter what you do.
So it doesn't matter if it's Oral-B, Sonic, it's just as long as it's...
It's better than being allergic to a toothbrush. And that's why I tell some patients that you must be allergic because you're not doing anything with it.
Well, my dentist used to tell me I used to need to come every 3 months. And he said because I had like a tartar build up that it just keeps... nothing I can do about it. It just keeps happening. I was like, I brush. He's like, that's just what's going on with your teeth.
And he probably poked around in your gums. You heard him call out some numbers, probably 4s, 5s, 3s. Normally, when you come in to see a dentist every 3 months, it's because you have that condition, the periodontal disease that I talked about. The problem is we haven't tell the patients, this is why we're doing that.
Okay.
You're coming in every 3 months for a periodontal maintenance visit, not a cleaning.
Right.
Not a routine cleaning. You have the condition. You will always have it. And we're telling the public your conditions right now.
That's fine.
But you will always have it. And but it's like I have hypertension. You know. But I take medication to control it, and I try to do things as far as my exercise. Periodontal disease is the most prevalent condition next to malocclusion in dentistry. That as dentists, we just go in and say, okay, you got to have this procedure done, but we don't tell you why that procedure needs to be done.
Question.
What's that?
It says, you're known for using the latest technology, but dental tech isn't cheap. How do you balance investing in cutting edge tools with keeping care affordable for your everyday patients?
Very, very challenging. You know, all that AI and stuff that I talked about. Yeah, it's an investment. It's an investment that I'm passionate about. If I can take that technology and make use of it to make the public more aware of what's going on in their mouths, it pays for itself. So that's not a hard trade-off. Again, where we used to sit up and look at x-rays ourselves and tell someone that you got tooth decay, and they just had to rely on what I said, as opposed to seeing it for themselves on the screen. And they can actually see it, you know, and I can delineate it in color, and I can show them the progression of the disease if they decide that they're not going to do anything, or that I need to think about it. Well, here's where it was 3 months ago. Here's where it is now. Or I can do a digital scan of the mouth, and I can show you how a tooth, much like a car tire wears down, if you don't straighten your teeth out and address what's called malocclusion, another disease that's not diagnosed, but 80% of the general population in the world suffers from malocclusion. You have people who actually have recession of the gums.
I heard that a lot.
Fractured teeth. Teeth fracture for a reason. They break for a reason.
Right.
Not addressing those conditions is the problem. So
a lot of people have trauma going to the dentist. They're scared. They I even expressed the story that I had trauma with I was having a procedure, and dentist, I told him that I could still feel something. So he shot me again and numbed me in my mouth. And when he shot me the last time, it was numb for like 2-3 weeks after, and I was like, man, I gotta call Mike. Mike, hey, what's going on? I need to sue him. And what was your answer to me?
It's been so long, I can't remember what I said. But sometimes medications can linger for some time.
Right.
Anesthesias can linger. And he didn't shoot you.
Right.
He anesthetized you. Let's get the terminology right.
He anesthetized.
He anesthetized you.
Okay, well, anesthetized. Anyway, that was my trauma going because when I went and I was having a procedure, now my mouth is numb for 3 months on the left side. So what, like when people have trauma dealing with that, like how do you make it comfortable for them? Because I know I didn't want to go back right then.
We talk about it. We actually talk about the experience. I mean, that's what I do. I said, tell me about that. I call it Sherlocking. I do a Sherlocking experience. Tell me a little bit about more what you were feeling when that went on. And if they get up to open up and they tell me what made them actually feel the way that they did, more often than not, with the aid of modern technology, I have a solution. I say, well, here's what I'm going to do instead.
Right.
You know, sometimes I actually sedate patients. If their trauma is that bad where they just cannot walk in the office without breaking into a cold sweat, I'll bring them in. I'll offer a sedative. Sometimes it's an oral sedative. Sometimes I place an IV in their arm and I put them to sleep during their procedure. But it's some other things I have to jump through hoops to make sure that it's a safe environment. They have to have somebody with them. And someone who's going to stay with them for at least 24 hours.
So you're soothing the patient.
I'm finding solutions to get them taken care of.
Right. So if they come in there with a trauma, we find a
Let's
solution.
find out what caused you to have that trauma. You know, because the days of a dentist standing in your chest and holding you down and taking your teeth out, you lose your license if you do that.
Right.
No one's going to do that. We don't have to do that. Okay. That's not the dentistry of the Wild Wild West.
Right. So with today, everybody is talking about getting veneers, and that's the new thing. That's the new fashion statement is having the biggest or whitest or just fake, I guess, implant. I ain't gonna call them fake. They're implants. Do you suggest implants, or do you feel like that's for if you just going on it for cosmetic reasons? Do you just want to look cosmetic? Is that something that you suggest?
Well, veneers and implants are two different things.
Okay.
Let's get that straight. Veneers is like a laminate. It's put on the front of a tooth, and there are indications as to why you would actually do that. Someone has intrinsically badly discolored teeth, and it's affecting them where they don't want to go out in public. That's the justification for doing that cosmetic case, but it's elective still. Implants is something different. If they're missing teeth, and I do a lot of implants, if they have nothing to eat with it, it affects their function, it affects their GI tract, it affects them psychologically. Those are reasons why you also do implants. But anytime you take a tooth out, there's the bone in your mouth is different than any other bone in your body. This long bone in my arm is not going to operate like the same thing. If I take a tooth out, that bone goes away. And once it's gone forever. So you want to put implants in those areas to prevent the bone from going away. It's a little bit different. But as far as when you do those things and when you don't do them, again, I said earlier, the best dentistry that anyone as a dentist can do for you is the least amount. Anything that's man-made has a lifespan. A veneer may last you 15 to 20 years. It may last longer than that. Any material that I put in your mouth as a dentist has a shelf life of 7 to 10 years before it has to be replaced. There's no filling that's meant to be there forever. There's no crown that's meant to be lasted forever. The only thing that's meant to last you forever is your God-given enamel.
Right.
And that's why we tell patients to take good care of it. That'll last you forever.
Right. And it's funny because I remember a while back, people were getting gold in their mouth.
Yes.
And that was the fashion.
Still doing it.
Well, I mean, not as much.
Or what they thought was gold.
Right.
Yeah.
But now it's the veneers.
Yeah.
It just seems as though the times changed, but it's still the same, still putting some type of implant or something that's not supposed to be in your mouth. And you said anything that's man-made is not going to last.
It's not going to last forever.
It's not going to last.
Meant to last forever.
And even, so with the veneer process, does the process mean you have to take out your real teeth or the implant?
Well, implants, no. You ain't no implants with veneers. That's
Okay.
a veneer is going to go on your natural tooth.
They're going to go on top.
On top, but you got to take away some of that natural tooth structure to replace it with the veneer.
Wow.
Does that make sense?
Yeah.
And again, sometimes doing that is beneficial and therapeutic. If someone has a condition called amelogenesis imperfecta, teeth are brown and black, healthy teeth, but they're brown and black because it's genetic. Mm-hmm. That would be an indication to do veneers, but if it's just an elective thing, that's kind of controversial. Do you do that? I'm of the mindset, and my mindset is that I first do no harm. Because if I'm going to take away your enamel, which I know will last you forever, and replace it with something I know is only going to last you for 10 to 15 years, I need to balance that out on why I'm really doing it. Right. So what's the why?
Yeah. And it's just want. It's not a need.
Exactly. And then that want may change as you
get
like older. Someone has gold teeth, and they say, you see them folks take them out now. People taking them out. And they realize this was a mistake. And when they take it out and they see what's left of the tooth, they're not, and again, most times that's not real gold. It's gold in color.
Right.
And it's not really kind to the gums. It's not maintained as far as hygiene. So again, it goes back to our miseducation as far as what our needs are and our values. Our values is what we place value on. Is what are priorities to us in our community.
Right. And a lot of people, you don't hear anybody talking about, I need to get my teeth fixed. And if they do, they put it on the back burner.
Yeah.
You know.
It's important.
Right.
It's as important as anything else in healthcare. Mm-hmm. The mouth, the gums, all that's tied to the rest of your body. Right. There are systemic disorders where you can see manifestations of that in the mouth.
Right.
Conversely, there are issues that you can have in your mouth which can cause you other issues as far as there's studies that show that gum disease, periodontal disease, what I talked about, some people call it pyorrhea. Mm-hmm. Pyorrhea, periodontal disease is tied to stroke and heart disease.
I didn't know that.
Yeah. You normally have what's called a triumvirate. If you got periodontal disease and you have hypertension and you have diabetes, you have a greater predilection for stroke or heart attack. And who suffers from that more? Us. Yes. So that's why I say it's important that you go. It's important that you go. And if you're seeing your doctor, you also need to see your dentist as well.
Are there any in particular dentists that you mentored from or?
Mentored me?
Yeah.
A lot of folks, fed into me in my youth here in Jacksonville.
Do you mentor any young dentists right now?
I mentor quite a few, several hundred.
Do you have a program?
It's kind of a mentor network of doctors, and they're doctors who are very passionate. The average dentist coming out of dental school right now, they're ill prepared for the realities of private practice and how to run a practice, how to practice successfully. When you come out of dental school, even as a senior, you may see 1 or 2 patients in the morning and maybe 1 more in the afternoon. That's not a real life scenario of actually practicing in private practice. Mm-hmm. So how do you actually run a practice is what you learn to do, and you become more proficient in your skill sets. Mm-hmm. There are procedures that I learned in dental school that I know that they're not teaching now, but they still need to come out and do those things because on Monday morning, those patients are going to walk in and still need those same procedures. So my network of mentors, we actually working to actually change. I want to say, we tell them, what you learned in dental school, forget it. Forget it. That got you your license, that got you out. But now let me teach you real world dentistry because people want it painless. They want it convenient, and they want to be able to get it at a reasonable cost. If you do those 3 things, you're successful. And then you make it a wow experience when they come in. They feel like family. And the best tools, I was telling a young man earlier today, he said, I want to be a dentist. I said, that's wonderful. What do you think is the most valuable tools you have as a dentist? Because you work with your hands a lot. He said, my hands. It's not.
Eyes.
No, not even your eyes.
What?
Ears and your mouth. You got to listen to people because you're trying to, connect and gain trust. If I don't connect with you and gain your trust, how am I going to get you to let me do what you need to get done?
Right.
Yeah. You got to have connection and build that levels of acceptance and trust where they will let you in their personal space and do what you got to do.
Okay. I'm going to ask a question. Who is Dr. Michael Badger when you're not being the dentist? What are some of the things that interest you hobby-wise, I think I heard you play golf.
I play a lot of golf.
Is that okay?
I'm not great at it, but it's
That's
my
something
next,
that you love to do.
It's something, like I said, I take a lot of classes in dentistry to try to refine my craft, and I'll continue to do that. I have a thing in my mind that's called can I. I'm doing the can I loop. I'm constantly and never ending improvement. Constant CANI, constant and never ending improvement. You're doing this podcast. You're going to always try to tweak it and make it better.
Yes.
I'm always trying to become better at what I do because I want to be able to convey that because I'm very passionate about what I do. My golf game, I'm just enjoying it right now. So some days I'm out there and the ball's sailing and it's going beautiful. But I'll go take some lessons and I'll go to my golf mentors and I'll try to refine my game and get my clubs fitted for me. Mm-hmm. And there are days when it goes perfect. But yeah, I'm passionate about playing golf.
I think you got one more passion too. I don't know. Are you a Jaguar fan at all? Because
unfortunately,
I see some of the things you say on your post.
Hey, I get a little upset with what's my man's name?
So how you think we're gonna do Trevor? Trevor.
I call him Trouble.
Oh, Trouble.
Trouble.
How you think we're gonna do this year?
I think he's gonna have. I think when he starts to gel with his new wide receiver core, we'll be better off than we were. It'll be worth it to come see the Jaguars. Okay. It'll be worth it for me to drive up here from Orlando and pay for the ticket, which I used to get ticked off about. And yeah, I'm looking forward to it. I'm a Jag for life, even though they piss me off sometimes.
Yeah, well, I'm a Jag fan, so hopefully we'll catch a couple games.
Yeah.
I appreciate you sitting down, taking the time with me, and bringing some light to dentistry because we got a lot of people who really don't know. And like I said before, ignorance is sometimes not because you don't know. It's because you don't know where to get the information from.
Yeah, absolutely.
And sometimes information have to knock you right on the head for you to understand or look at it and see where it is. Absolutely. So I want to bring some information. That's why I asked you to come. And if you guys don't know, this is my cousin, Michael Badger. He pulled my wisdom teeth out when I was 16. So I told him, you owe me one. And I think this is about who you were.
And I didn't pull out his wisdom teeth. I luxated wisdom teeth.
Well, this has been, do you have anything you want to shout out before we go? You got any organizations, foundations, anything?
I have a lot of colleagues. If this is just for folks in the Jacksonville area, a lot of colleagues who practice here. I'm on the internet, Facebook and Instagram. I'm happy to share the names of those individuals because they are very passionate as well. We have a very passionate network of doctors who I work with. We believe we're changing the face of dentistry, and we do it one patient at a time. But we have probably 428 practices in the state of Florida that I'm the president of. We have 1,700 practices nationwide. We all believe the same thing. We want to change the image of dentistry and how it's perceived so folks can get healthier and take advantage of these new technologies. Like I say, it's a liquid. We can paint on the tooth and literally grow that tooth back. Grow the tooth back, and it can cost you as little as $120. Now you let it fester, and that same problem will grow over the period of time where that $120 fix, which would cost you nothing and no pain, can cost you several $1,000s to fix one tooth.
All right. So 120 over several thousand.
Make the investment. Go see your dentist twice a year. Go see any healthcare that you need to go and just take care. We need to take better care of ourselves.
Yeah, that's what I'm promoting. Yeah. We got to take better care of ourselves.
Yes.
All right. This is Myron Mitchell, and this has been Dr. Badger. Real Talk with Myron. We'll see you on the next episode.